So what you're watching here is a video representation of how our skeleton carries excess body fat every single day. Now this our fat might look very soft on the outside, but internally structures like our muscles, our joint, our spine, our bones helps carry these structures every single day. Now let's talk about bone density, which simply means how strong, firm, or even solid our bones can be. Now let us imagine our bones as a pillar of our body. The stronger the bones, the more weight they can carry. But every pillar or every bone has a limit. When your body begins to carry excessive fat over the years, your skeleton begins to experience continuous pressure, especially in areas like your hips, your joint, your ankle, or even your lower back. Even to do the slightest thing become very difficult to do. And this constant pressure creates what we call mechanical stress on either your bones or even your joints. Even over time, the cartilage between your joint begin to wear off, your nail begins to lock against each other and rock against each other. Things like movement become very difficult, posture begins to change, and pain begins to exclude from your lower back. And that's why people with obesity develop things like chronic knee pain, hip pain, lower back pain, reduced mobility, difficulty in walking early in life. And sometimes some people don't realize that because of their big or their fat, it doesn't automatically mean that their bone is also strong. Even though you're big, it doesn't automatically mean that your bone is big. Yes, some people might have like large bone density and some people might have like small bone density, but because of your big, it doesn't mean that your bone will be big like you. Sometimes even your muscles and your joint can't even adapt to the amount of fat you accumulate in your body, because sometimes the fat grows very, very faster. And even at this point, if the bones begin to experience something known as mechanical stress. This conversation should never be about mocking people and their body size, because some people struggle with obesity due to hormonal issues, illness, medication, lifestyle factors, even genetics. But it's here to educate people on how excessive body fat can actually affect their joint, their bones, their posture, even to avoid something like long-time complications. So till next time, follow odinakasumary for simple, educative health education. Till we meet again, doo-doo.